Hey everybody, it's Dr. Eric Balcavage, back for another edition of Thyroid Thursday, and today we're going to talk about how hypothyroidism develops. I had a patient ask me in the office the other day, how did I develop this hypothyroid condition? And so I figured, since she was asking, I'm sure there's a lot of other people asking, and I figured I'd put together a couple of videos to kind of explain this. This will be a multi-part series, so this is definitely part one, and I'll have these rolling out over the next couple of weeks so that you can kind of follow along. Before we can dig into the meat and potatoes of why hypothyroidism develops, we have to keep in mind a couple key points. The first is that there's typically two forms of hypothyroidism, and you may hear about a lot of different patterns of hypothyroidism, but really it comes down to two things. There's either glandular hypothyroidism, and that's when the gland cannot produce enough thyroid hormone, so thyroid hormone production is down from the gland, there's lower levels of serum thyroid levels, and because there's low glandular production, there's lower serum levels or plasma levels of thyroid hormones, there's lower levels of thyroid hormone in the peripheral cells. So that's glandular hypothyroidism. Cellular hypothyroidism just means there's not enough thyroid hormone getting from the bloodstream into the peripheral cells. The gland can work perfectly, but there's a distinction between the two things. Traditionally, conventional medicine really only looks at the glandular problem. We look at the symptoms of hypothyroidism, but we only start to consider treatment when the gland becomes dysfunctional. But key point is that you can have glandular hypothyroidism, the gland can't make thyroid hormone, or you can have cellular hypothyroidism. If you have glandular, you're probably going to have cellular, but you can have cellular and have totally normal gland function. So hypothyroid symptoms are caused by decreased thyroid hormone in tissues, in the peripheral tissues. So we don't develop hypothyroid symptoms because the gland isn't making sufficient amounts of thyroid hormone. Now, that sounds contradictory, but if the gland didn't work at all, or you had yours burned out or radiated out, if we just gave you thyroid hormone, and that thyroid hormone that we gave you in prescription form was able to transport into the cells and convert into active T3, you wouldn't have hypothyroid symptoms. So it's not necessarily about the gland, it is about how much thyroid hormone gets into your tissues. And this is lost many times in conventional medicine and sometimes in functional medicine. The third key point for this video is that most cases of hypothyroidism, about 90%, are caused by autoimmunity, a condition called Hashimoto's. And in Hashimoto's thyroiditis and Hashimoto's hypothyroidism, what happens is the immune system attacks the thyroid gland and decreases the production of thyroid hormone, okay? Now, oftentimes we look at this, or it's talked about Hashimoto's as this immune system going out of control or this mistake by the immune system. I don't really look at it in most of those cases that the autoimmune condition is a mistake. Matter of fact, more times than not, I look at that autoimmune attack as the innate immune system trying to protect the body. It's trying to decrease thyroid hormone physiology, thyroid hormone production in an effort to slow metabolism due to stress. And that's really what this series is going to be, is talking about how that occurs. The fourth point of this video is that you can have hypothyroid symptoms and normal gland function. I talked about that up here, but you can definitely have normal glandular function. You can have no autoimmunity, the gland can pump out T4 and T3, but you can have hypothyroid symptoms. This is where many conventional medical doctors get confused. They assume if you have this list of symptoms, that sounds like a hypothyroid condition. They may even diagnose you with a hypothyroid condition and run a metabolic panel, or they'll run a thyroid panel. Now, instead of running a comprehensive thyroid panel that's 8 or 10 labs in that comprehensive thyroid panel, they'll just run a TSH and maybe T4. There's some doctors arguing that only a TSH is needed because that's the only thing you need to do to determine what the thyroid hormone state is in all the cells of the body. Obviously, I've talked about that many times in the Thyroid Thursday videos. That's not true anymore. And I'll actually pull out a recent paper from 2016 where a doctor states that and kind of talk about the points on that. But you definitely can have normal gland function and hypothyroid symptoms because there's insufficient thyroid hormone transporting from the plasma into the cells. if you don't get sufficient thyroid hormone transporting from the plasma into the cells, from the blood into the cells, you're going to develop hypothyroid symptoms. The next point is cellular hypothyroidism is often a normal innate immune response to stress. Now, if you have hypothyroidism, you're saying, hey, this isn't normal. If you're tired, fatigued, your hair's dry, your skin's dry, your hair's falling out, if you have any of the symptoms of hypothyroidism, you're not considering this a normal situation. But I'm going to explain to you in one of these videos why this is a normal hypothyroidism at the cellular level is induced many times as a stress response. So we're going to talk about that, okay? And the last point for this video is that Hashimoto's, this autoimmune attack on the gland itself, is often a normal immune response to the stress that we have in our lives. And we'll talk about that. If you remember some of the other videos I've done, I've talked about this thing called a cell danger response. So we're going to bring that cell danger response back. I'll talk about it again, and I'll talk to you about how stress triggers the cell danger response and how the cell danger response decreases thyroid hormone transport, induces a hypothyroid state, and can actually induce an autoimmune attack in an effort to address the stress response or the threat response. All right? So that was today's Thyroid Thursday. We were talking about, this was part 1 of how hypothyroidism develops. All right? Take care.